Coming up, the future of the NHS is under threat. The Health and Social Care Bill has been some time in the making, but this week could see the beginning of a Boris Johnson power grab, seizing greater control over the NHS in England. Keep watching. If you enjoy these videos, please hit the like button, subscribe and get notified of new videos every Wednesday and Saturday. You may remember that before rishier than the Queen Sunak was appointed Chancellor of the Exchequer, it was Sajid Javid who was in charge of the nation's finances. He resigned because Boris Johnson ordered him to fire his team of aides, saying that no self-respecting minister could accept such a condition. Well, it seems that by taking over as Health Secretary from Matt Hancock, Sajid Javid has jumped from the frying pan into the fire. Johnson has ordered him to introduce the Health and Social Care Bill to Parliament, despite Javid's reported pleas to delay it until the autumn. He's expressed concerns that the controversial bill will lead to a rebellion amongst Tory MPs, anxious that the bill aims to shake up the NHS with the biggest reorganisation for almost a decade. They see it as a gift for Labour, who'll be highlighting the additional powers and controls it gifts to the government and pointing out the erosion of the independence of the NHS management team. Hospital bosses and top doctors and nursing representatives are very concerned about the proposed legislation, and Labour have already called for the bill to be scrapped, calling it a power grab. Sajid Javid's concerns are that if Labour are successful in convincing voters that the government are taking closer control of the NHS, then the government itself will be blamed for delays in treatment and closure of local hospital units. This, of course, would be an absolute gift for Labour. So those are Sajid Javid's concerns, and he's not the only Tory with concerns. Former Tory MP Ben Howlett, now boss of a public policy think tank, thinks this power grab could backfire on the party as the Health Secretary becomes directly accountable for service provision at a local level. And he thinks it'll be the MPs who'll be forced to account to their constituents for long waiting lists, poor recovery outcomes, overrun A&E departments, etc., without being able to shift responsibility back onto the NHS management. So those are the Tories' concerns, as usual, motivated by self-interest and political considerations. But more importantly, why should you and I be concerned? Well, the Health Secretary's new powers would allow him far more leeway to decide, for example, whether an A&E or maternity unit had to be shut down due to, say, run-down facilities or even something as transient as temporary staffing problems. The two groups which represent health service trusts, the NHS Confederation and NHS providers, have both warned that this could allow ministers to wield undue influence over the NHS and reduce its independence. Matthew Taylor, the Confederation's chief executive, said they're concerned that some of the proposals could lead to heavy-handed ministerial involvement in day-to-day matters affecting the NHS, such as the closing or opening of new services for patients, which could go against the advice and expertise of local leaders who know what's best for their communities. The new powers for the Health Secretary would allow him to interfere in how local and national management do their jobs. This is fairly typical of this extreme right-wing populist government who've made it clear from the very beginning that they've had enough of experts, bloody health professionals thinking they know better than cabinet ministers about how to deliver health and patient support services. And how does this bill help tackle the current crucial NHS challenges like waiting times and chronic understaffing? It doesn't. And the British Medical Association, the doctors' union, warned that it could lead to large contracts being offered to private firms without any competitive tendering process. Ring any bells? Everything loops back round to Matt Hancock, doesn't it? A likely repeat of the Tory corruption where billions of pounds worth of contracts for personal protective equipment, PPE, for NHS staff were handed over to Tory cronies, families and donors during the pandemic. And this time round it'll be worse, as the Tories will have learned from experience and got even better at siphoning off these massive taxpayer resources into the pockets of their associates. David Wrigley of the British Medical Association, the doctors' union, has said he's very concerned that private health providers could be given seats on the boards of what are now to be called integrated care services, responsible for health and social care, and that these same private healthcare providers could be involved in deciding who gets which rich contracts. This could mean that contracts are just handed out to the private sector without a competitive tendering process. It just sounds like an expansion of the Tory corruption industry to me. Meanwhile, Sajid Javid, along with the board of NHS England, will soon have to decide on the new NHS boss. Simon Stevens has looked after the NHS for 7 years now, pushing the government to radically reform social care and how it integrates with the health service. He's also been a powerful advocate to get the government to commit more money to the NHS. The Tories are probably glad to see the back of him and will doubtless take the opportunity to replace him with somebody a lot more demure and lower profile. And of course, in addition to that, the new NHS boss will in any case have far less power than Stevens did as a result of this worrying new health and social care bill. But there is some good news. Apparently, Javid is dead set against the appointment of Dido Harding after her disastrous reign over the failed £37 billion failed test and trace system. Whoever he gets in the post surely must be better than the ex-jockey wife of the Tory so-called anti-corruption czar, John Penrose. But whoever it is, the future of the NHS is not safe in Tory hands. Our health service is, at root, a socialist system, which is anathema to this free market, profit-obsessed government. Nearly 5 million people are currently waiting for treatment, and although COVID obviously pushed our health services to the limit, years of Tory underfunding meant it was already in crisis before the pandemic. Waiting lists were also already rising, as were the huge staff shortages. So does the government put forward some radical, innovative solution to address these issues? No, of course not. True to form, it orders yet another drastic reorganisation of the NHS in order to grab control and pass lucrative, publicly funded contracts to their cronies and donors.